All right, it's 6:30. Call the meeting to order. 2.0, prayer. Mr. Whalen.
All right, let's pray. Lord God Almighty, thank you for this opportunity to once again come before you and serve the people of Stephenson County, the people at Stephenson Nursing Center, those who live and work there. We pray you help us make good decisions tonight. And through this whole thing. Thank you, we pray in Jesus' name.
3.0, approval of tonight's agenda. Do I have a motion to approve?
So move.
And Mr. Whalen, do I have a second? Second. By Mr. Meester. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. 4.0, a review and approval of meeting minutes from December 12th, 2024 meeting. Do I have a motion to approve?
So move.
And Mr. Whalen, do I have a second? Second. And Ms. Jackie, any discussion on the minutes? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. 5.0, approval of claims totaling in the amount of cash requirements and manuals, $309,005.11. Do I have a motion to approve?
So move.
By Mr. Whalen, second by Mr. Hadley. Any discussion? Good. Being none, all those in favor say aye.
Aye.
Opposed? Aye. 4-2. Public comment. Do you have any public comment? Please state your name. You got 3 minutes.
Yeah, my name's Jody Potts. I'm here to, mostly I want to be put in the record that I believe that what you're doing by getting rid of TCM is really reckless. We've already done what you're proposing. One of the county board members said, we're going to just do it in-house. What happens if that person gets in an accident, has a family member that gets in an accident, can't work anymore, decides to go somewhere else? It could happen in today's, times very easily. So we're putting all our eggs into one basket. We've already done it. It didn't work before. TCM, I've talked to some other nursing homes. Management to, the 5% commission is very standard. And I think you're being really, really reckless.
Thank you. Any more?
It's fine. I live over in Freeport also. I would also just like to address the relationship between TCM and the county board itself. It's stunning to me that there has not been recognition of the good work they've done for the county, because actually they work for the county. You all work for the county, not. And from coming in and really taking a nursing home that was in crisis and taking care of the billing, getting fines reduced, getting staffing up, actually now the increase in the star rating, it's all in a positive direction. And I don't understand at this time, and I absolutely think that if we're lucky right now to have the possibility of a permanent administrator who is competent and is taking care of things. But I think it's a team effort, and I would really hate to think that we wouldn't want to keep what has been successful, because TCM has done a tremendous job for us. They still are, and yet they really don't get the recognition. And I don't understand that. It's like, and it was really obvious by hearing comments in the full board, the last full board meeting when they approved the RFC, that the board does not appreciate, doesn't really understand what TCM has done for us. Thank you.
All right, moving on. 7.0, reports to committee. As you guys can see, each department head did submit their first report to the committee. We will be building on them each month. So if anybody has any questions, Mr. Perez is here to answer those committee reports or questions. 7.1. Marcos, sure.
Okay, now that we're in the new year, as far as January now in this case, I made a few adjustments to the format of information that I provide to the committee membership, as far as more of like a departmental breakdown. So I can make sure that there's any specific questions as it relates to any particular part of the operation, we can kind of adjust it or address it in that way. But starting with the same format I've used in the past for census information to kind of get an idea of where we've been and where we are and where we plan to go at this point. Current census at the time that I wrote this report was 45 in-house. Current census today is now 48 as we continue to push on towards getting back into the 50s at this point, which is we'll say it's a much better place to be. Census, just to note, on December 31st of 2023 was 38. So going from 38 at almost a year ago to now 48, I think is a good step in the right direction as far as what that is. And now moving ahead, and I said now even into the 50s. Average monthly census, as indicated on the report there, for December was 44. So me having taken over the reins in early August of this past year, just moving in an upward direction in this case, as reported there. Average monthly census numbers in this case for December, November, and even going back into October, building kind of on an upward trend in this case as far as those months. And now moving forward now into January, which should show continued upward momentum. I will say that our flow of referrals has drastically increased in the past week or two. As I had reported out to the members of the facility management as well as county administration, that for as these reasons do happen, our facility, Stephenson Nursing Center, is now the top rated facility on the CMS Nursing Home Compare website, which is kind of our primary site for the public to be able to view and compare nursing homes across the board. As far as overall, from a survey history point, from a staffing standpoint, and also for quality indicators, which also are reflective of the facility too. With us holding at a 3-star rating, our nearest competitor, Manor Court, has dropped down to a 2-star. So I think that probably played into it a little bit, despite whatever relationship that they might have with the local hospital system and any other referral sources past that. So we had, at this point, jumping ahead a little bit to point F on there, our admissions for December were up to 8 in this case, and we're opposed rather to continue that same pattern now in the month of January. Most of the referrals which ultimately convert into admissions are primarily those of the short-term type, short-term rehab to home for the most part, and those that are able to successfully rehab to home. Some, a smaller percentage do not, so they end up many remaining as far as long-term stays in the facility. And so to an extent that does happen as well. But again, going on that same upward trend, for the census I reported as of the time of the writing of this report, as I've shown before, as it was 45 as of that day, reflecting again, just kind of a basic breakdown there as far as our Medicare Part A, those residents that are using that short-term benefit that they can make use of. Those that have traditional Medicare, those that have insurance companies that manage their insurance benefits for as far as their Medicare Part A benefits. Same thing for Medicaid, so as far as a long-term stay, or on average a long-term stay in the facility. Those that have insurance companies as far as what we call managed plans in the facility for both Medicare and then also, like I said here, as far as Medicaid. One hospice individual, also under the Medicaid insurance program that is receiving hospice care. For Medicaid pending, which I think I mentioned in the December meeting, there will be some individuals that maybe either come in short term and don't have a Medicaid even as a long-term payer source, but then the business office will work with them to apply for Medicaid so that it could have a payer source or an insurance coverage for a potential long-term stay. Or those we might admit that we would the plan from the beginning would be to cover them or get them signed up for Medicaid so that they could have insurance coverage for, again, another potential long-term stay. So that number there, we could try to watch over that, just make sure it's not, doesn't get too out of hand as far as those Medicaid pending numbers in this case. And then, of course, those that have Medicaid, traditional Medicaid plans and don't have an insurance company to manage their Medicaid benefits. Our private pay numbers have increased a little bit. You'll see as reflected there as well, as far as traditional private pay and those receiving hospice care that are also paying private pay for room and board. Because the Medicare hospice benefit, which has been around for Lord knows how long, does not pay for room and board. So as far as our primary room rate per bed per day, it pays for just those hospice services for hospice agencies to come in and provide those services to the residents that receive that level of care. So just as far as a basic breakdown there, I had already touched on admissions for December, reporting from our electronic health record system, Matrix Care, 8 admissions for the month of December, 4 discharges, and then also 4 people that were sent out to the hospital. So I'm just going to give a basic breakdown as far as that. Again, giving kind of a historical perspective for December of 2023, the facility only had 3 admissions for the month, as compared to now 8 in now past December, just last month. In December 2023, again, 3 admissions that they had at that time, 1 discharge and 3 hospital leaves. So definitely, again, on an upward trend at this point, now going from December now into January and let alone February. So we're going to see kind of where we're going at this point as far as that's concerned. And again, now going into point 2 or section 2 as far as the departmental breakdown. You'll note there, just for the committee members' own informational purposes, just noting in bold the members of the department heads, in this case, the management staff that manage their individual departments. Just to note that, and I'll have that on each report that I put out, just to keep that in everyone's mind as far as the individuals that manage those areas. Brenda Rothschild, as far as our activity director for our activity department. The committee chairwoman has asked that we provide an activity calendar for each month as we go through each month, so you can kind of see the activities that are being provided for the residents as a whole. Our activities is obviously a key area for any facility, just as much as really anything else. It gives basically an overview of our ability to keep the residents engaged, so that families come in, they can see, what our activity programs look like and how we're keeping their loved ones, engaged, for lack of a better term, as for the time that they're there, either short term or long term. And so, Brenda, obviously with a new addition of new residents, getting an idea of what those residents' activity preferences are. And so we can kind of adapt our activity program to better meet their needs as we go through, month to month in this case. Accounts payable, and obviously the committee has already reviewed claims from the previous month, but just noting as far as accounts payable operations, and Carolyn Burke, in this case, our part-time staff member who's kind of been assisting in getting our claims more efficiently processed. Conversations between the business office manager, Jennifer Alanis, and myself and Carolyn Burke as to invoices that are to be processed throughout the course of each month. The claims that are submitted, as I had to come to learn here as far as how Stephenson County does things through the treasurer's office and such. As far as the claims that are submitted in every nursing home committee meeting or nursing center committee meeting, those basically being signed off by the committee and then being sent to the treasurer's or the full board for approval as well, and then being signed off by the treasurer or being processed by the treasurer's office, but not necessarily being paid then at that time. We paid them as we're able to based on the available funds available in our operating account in this case. So, and having to get together on a more regular basis to try to better structure as far as how we're paying what we're able to pay, considering, as the management company can speak to, as far as past due amounts on accounts payable items, as we've discussed in every meeting that I've been on board for. So just as far as an update on that. As far as admissions, again, I kind of touched on that already. Jeannie Cross, our admissions and marketing director, I've tried to put more of her focus as far as outreach and networking, as far as building our relationships with our referral sources that we work with, both in the immediate Freeport, Stephenson County area, and also into nearby hospital systems in Monroe and also in Rockford as well, and beyond. So I think that those efforts have paid off as well, as far as her efforts in this case, and her continuing efforts to try to maintain those relationships and improve those relationships as far as the referrals that we would receive going forward. I think she's, like I said, been very successful in that way as far as her efforts. And hopefully those will continue to demonstrate that with the numbers that we show for as far as admissions and such, and number of referrals that we receive. She does submit the tracking form as far as referrals received to Charles Ross with the management company, as well as, I believe, the Madam Chairwoman, and I don't know who else receives that. That's up to myself, I guess, in this case. So.
I'm not too sure.
Okay. So but she does send that out as well. But if somehow the committee does not receive it as a whole, we can certainly provide that for the committee's review as well. So you can kind of see the referrals that we're tracking, that we process as we receive them. Not every referral is appropriate for our facility. So it just kind of really depends. But I try to challenge the nursing department to, be able to handle the care of a multitude of individuals dealing with a variety of medical conditions. We are a skilled nursing facility. We do have licensed nurses and certified nurses aides to be able to meet the needs of those that are affected with various medical conditions. And so that is always the expectation as far as admissions in this case, and working with our clinical team to do that. As far as the business office as a whole, as far as our financial operations, obviously the management company has been overseeing that in time, at least since I've been on board, if not before. So as far as billing and collections, so we've obviously been working with the management company in that time to that end. As far as Jennifer, working with members of the management company that she works with as far as billing and collections in this case. Dietary is headed up by Sue Bechtel, who is a contracted member of staff. The facility is contracted with, most recently, in its decades of operation, Healthcare Services Group, which is a contracted group that oversees our dietary operations. Sue being all the dietary staff being employed by them, and the facility had long since contracted with that dietary group to manage those areas of the operation. I will say that, as I think I might have commented on before, from families and residents, while there are certain things that come up at various times, as far as our dietary services, as far as food and beverage services, I have not been aware of any major issues from residents and or families, which is a testament, I think, to the services that they provide in this case. So, and Sue has been in the building for how long? Probably over a decade, if not longer. One of her primary cooks has been out with her, I think, since that time too. And from what she tells me, most of the time the facility has had a contracted dietary department. So again, long before I came on board. So, and that tradition continues with, again, the current contracted dietary group that services the facility. As far as environmental services, which are handled by Ms. Tina Toti, our environmental services director, as far as housekeeping and laundry services. On the whole, I also, I feel that we do a very good job in those areas as well. One of the biggest areas a lot of nursing facilities deal with is missing clothing. That hasn't really been a major issue for the facility, at least in the time that I've been on board, which, again, having overseen things now for about 4 to 5 months, I've not had any major concerns in that way. But this department also takes care of our overall resident environment as far as the cleanliness of the facility. And any resident or family complaints or concerns related to, are we maintaining a cleanly or a clean environment for their loved ones to live with? Not to mention the transmission of illnesses, whether they be viral or bacterial. Hopefully our efforts to try to keep that to a minimum as far as transmitting illness throughout the facility. As far as our disinfectants and other chemicals that we use to maintain the sterilization of the facility as a whole, especially during the years of COVID and how that affected the facility and all of that. Now with reports of the facilities across the nation, even obviously here in Illinois, dealing with norovirus and dealing with other respiratory conditions, that's or as important as ever as far as the efforts by that department. Our maintenance director, Sel Shelley, who's been on board for about 1.5 years, I want to say, he submits, of course, as he always has, his maintenance report for the facility. As I've given a report to the committee as a whole and to the county administration as to the HVAC work that's been in progress, the latest report I have for that is that the completion of the work that's being done as far as the air handling systems on the north end of the building, affecting the Birchwood area parts of the facility, should be able to be wrapped up probably within the next week. And then they'll move on to the south end, and then that's pretty much it as far as what's left to be done in that area, as far as that work in this case. So just to note that. For the month of December, there were really no major maintenance items to report. And by the grace of God, we've not had any, I probably shouldn't say this, but we haven't had any major, snow and snow removal issues, I guess, in that way. God help us for all county. I'd say for all county facilities. So the sake of all of us included. So we just, again, continue with our efforts in that way as well. Our Human Resources Department, headed up by Ms. Kenna Martinez, assists with orientation of new staff as far as the processes related to that. As far as, basically all of that. And also efforts with onboarding and maintaining as far as new staff, new employee recognition programs that she and I have worked together to roll out for the facility, just to try to give staff, a better sense of morale. And as far as that's concerned. So I think we've had some success in that way, but there's still more to be done as far as those efforts as well. So those discussions I'm sure will be in forthcoming committee meetings in this case. Joy Sunga heads up our medical records program as our medical records coordinator. She had been brought on under the previous administrator, and she has proven to be very adept, very effective in her role, getting all of our medical records organized in the facility, which took place, like I said, prior to me coming on board. As far as just the level of disorganization, I think that existed within the facility prior to her arrival, and getting paper documents organized, getting them scanned into our electronic health record, even the maintenance of all of the records at this point, as far as any records that would be submitted to her to be scanned into the system, as far as any resident's clinical record. That's an ongoing process. We've also expanded her duties to include assistance with insurance companies as far as submitting documentation for continuance of insurance stays or insurance coverage for residents coming in for short-term rehabilitation, so that their insurance companies would hopefully continue their benefits so they can continue to stay in the facility. So she's been assisting in those ways as well. Not to mention audits that we've.
I'm sorry, if I
Go
can
ahead.
interject. What might ring true for everyone here at the table is the authorizations, like prior authorizations, pre-authorizations. Like if you were to have a procedure, need something, it's a big part of what we have to do now with the MMAI programs and managed care. So that's what Marcos was talking about with the kind of being in touch with the insurance companies. That's, you have to keep up with that, not just initially, but ongoing through this day.
Which is, no, you're fine, which is definitely an effort. So as far as that area in this case, and again, as I was mentioning, as far as audits that we receive, that we work with the management company with regard to as well, in terms of processing of documentation that needs to be submitted for review for potential either maintaining what the reimbursement we received, or potential recoupment if the auditors find that maybe something, a T wasn't crossed or an I wasn't dotted. So she's assisting with those areas. Our Director of Nursing Services, Annette Williams, who came on board upon the retirement of the previous DON, I think in May of last year, I want to say. She's headed up the department in that time. She's, I think, been effective in that way, as far as a lot of her efforts go into staffing her department, which the nursing department, by definition, being the biggest department for any facility, as far as the CNAs and nurses that she schedules. Scheduling is no easy job by any means. For any facility, having done the job myself in the previous facility, especially in these times, as far as any facility anywhere in the entire country, as far as the availability of nurses and certified aides in this case. But she, of course, also oversees all of the nursing services, including working with her wound nurse and infection preventionist, restorative nursing programs, so the restorative nurse that she works with, as well as the MDS, or the assessment nurse that she works with, who's also a registered nurse that oversees the assessments that are submitted on a routine basis, on a minimum quarterly basis, as far as the clinical status of any resident that affects our reimbursement from Medicare and Medicaid. On the regulatory front, again, as I mentioned, even last month, again, still pending our annual survey. Kind of on borrowed time, I guess, at this point, as far as what that is, and still planning for that, or so just doing any remaining items that we can prior to their arrival, as far as the survey team looking at all the areas of the facility, as far as how we operate and the level of care or quality of care, in this case, that we're providing to the residents. They came in January of last year, so actually a year ago they came. So, kind of in that time frame for their arrival in this case. So planning still for that. And then finally, under social services, our social services director, Nancy Yules, heads up the department. She's been on board in that facility for approximately, I want to say 8 years, maybe 9. So she coordinates as far as discharge planning for the residents. She also oversees all the ancillary services like dentistry, optometry, audiology, podiatry to come into the building, as well as mental health services that the residents would need. When they get discharged to go into the community, she sets up services with like home health care agencies, outpatient therapy services to be able to provide for the resident once they would go back home, whether that's at their private home in a residence in the community, or if that's an assisted or supportive living or independent living, or whatever that may be. So she oversees those areas of the facility for us and has been for some time, and I think is successful in that. So those are kind of the major areas of our facility operation. I just kind of want to break down in that way. So that way, if there's ever any particular question as to any particular department's operation, the committee in this case can ask as far as what that is, and we can address that as far as in that way now too. So Continuing to move onward and upward at this point. That's my report for January.
Thank you. Any comments or questions for Marcos?
Good job.
Seeing none. Moving on, 7.2, CCM.
Let's start with the P&L. Facility lost $28,843. Census for the month of November was 43. So it's fantastic that the building's at 48 now, hopefully with 50 plus. Each one person higher census is 9,000. So in general, could be more. So, Medicare type payer, but so yeah, 48, 50 plus should be profitable. Any questions on the P&L? Let's go to accounts receivable. Let's see the total accounts receivable. This is for report the period ending November 30th. $1,092,014.72. $225,862.56. And the 12-month and full category. I wanted just to mention one thing. This could be a last meeting. The negative balance on the Meridian, more than 12 months and over, it's truly in the 30-month and over category. Take it all the way out. It's an overpayment. It's reported as an overpayment, and that's why you see the negative number. That number used to be bigger. We've been in touch with Meridian. They claim there is no overpayments. They paid us for everything that they should have. Problem is that, some of these. So what this means is that somewhere along the way, again, more than 30 months ago, someone from the nursing facility didn't put the charge in. Big John Doe, $5,000. They didn't enter the $5,000. Received the $5,000. But we were due the $5,000. So no one's unhappy. Meridian's happy. We're happy. But at some point, I would say from whether it's this board or the finance committee or the treasurer, what works, somebody negative balances quite bold. It looks like it's an overpayment, but it really isn't. Should be adjusted. It's not something that we, as the management company, would initiate and do without your permission. So forward, someone should take a look at negative balances and decide whether they. Any other questions on accounts receivable?
The only one I would have, Mike, is there's obviously a transition obligation in the contract. BCM to fulfill that obligation going forward to try and get this money in. It's still due. Correct.
Well, cooperation, there is a cooperation.
Yeah, I have it right in front of me.
So what is the definition of cooperation? Definition of cooperation does not include that we will do work. Yeah, we certainly will cooperate with handing over software codes and anything that you ask us to hand over. But cooperation does not mean actually doing billing.
I'm not expecting you to do billing going forward. Collect, you've already done. That would be my expectation.
That's not the way I would interpret the contract.
Well, I'll read it to you. It says promptly.
I know what it says. Yeah.
Well, for the public record, I would like to read it. It's promptly and for 180 days following the effective date of such expiration or termination, use reasonable efforts to cooperate with the operator, which would be the county, in servicing, administering, and collecting the facility's accounts receivables and any settlements. I'll leave it at that.
Yes, we cooperate with the operator in all those things. but the point person now switches to the facility. We're cooperating with that person, the facility is actually doing the billing. Another thing that I'd like to point out. If we get to the 17th of January, we have solved this. All communications, no matter what they are, will have to go through our attorney. That. Cash flow, oh, sorry.
Well, I got a question. Seems like, I'm out of the loop on something, so, you went through with, sending us a letter on the second?
We sent it effective the 7th.
Okay, you sent us a letter stating that, could you tell us for the record what you stated then, please?
Yeah, attorney letter. We sent it. Terminating the contract for clause for not payment effective January 7th. 10-day cure period. And after that 10-day cure period, which will be January 17th. If things weren't resolved, so. Be done.
So last month I brought up that, devastated about this and that I had recommended to the finance committee that, we look in, trying to figure out a way to get you paid and, still keep you. I'm still in the hope. Has anybody reached out to you
Yes.
to keep you at the facility or?
There are talks.
Okay, okay. I think you've done an outstanding job for the county. I think we're gonna be, looking at, hiring our administrator full-time and, month. I'm happy to see that on the agenda, but I still think that, we need to have an administrator slash management company because a long time ago, many board members said, we don't know anything about running a nursing home. Well, we fixed that problem. We got a management company in there. Now we got a capable administrator we're gonna put in there. So hopefully, apparently Mr. Whalen knows more than I know, but, happy that there's some negotiation going on and that you guys might be able to stay, and I hope that's the case. Thank you.
Yeah, some cash flow. I mean, everyone gets the treasurer's report, so, we see is some cash flow come in, that standing, that it goes down to the 7th. Cash goes up for a week or so, then the cash goes up to about $1 million. So that's the range that we've been in for quite a while now. So, hopefully that will improve if the census stays up. So that, there are actually profits where we can chip that down. Questions on that?
Okay. Moving on to 8.0 new business, no new business, 9.0 old business, no old business, 10.0 public comment.
Yeah, Jody Goss again. A couple of things. February 8th, Laura Youngblood and I are holding a Valentine card making event for the residents out at the nursing home, 12:30 to 2:30. Everyone here is certainly involved. It's always been really popular. A year ago, we made, I think, 100 blankets for them. So I was seeing some of that coming up on my Facebook page. So we're now seeing improvements with our census, which I'm really happy to see. I was kind of shocked last month when the board, challenged that it has not been for sale. It was a pending sale from the end of 2022 through the entire year of 2023 and until February of 2024. It was thought to be for sale. So, it's like you want to just cover that part of it up, but that did really have an impact on what was happening there. Marcos just talked about all of the different people that he is managing out there. All of the department heads, all of the employees, all of the families, the patients. And you guys want to throw him one more thing to do. You know, that does not seem reasonable. Insurance companies are really complicated nowadays. The pre-existing, you know, trying to get things like that approved is really, really difficult, hard to stay on top of it. And who knows with the new administration, what changes there might be in Medicaid and Medicaid patients and the cutting to Medicaid. So I just hope that you will consider keeping TCM, even if it's just for 6 months, to get the census up to a reasonable amount.
Couple other things that I do know that when Mr. Filippo started with the nursing center committee, he said, don't worry about paying me. We know that you guys are way, way behind. Just, you know, we'll get, you know, I know you'll catch up. Well, basically that never happened. And that's the thing that's kind of bizarre, because anybody here who has been involved in business would not do business for somebody if they owed you $350,000. You just wouldn't do it. You'd cut them off. Say, I'm sorry, we can't do it. Now, they have been extremely, extremely patient. And I don't know why paying them was not as important as paying the administrator, all of these department heads, the nurses, the CNAs. Why wouldn't you pay the people that are bringing the money in that work for you the same as you paid anybody else? So it should have been caught up a long time ago. The other thing I just found out that really is interesting, I talked to Lester Robertson, who happens to be a retired administrator. He's actually a board member of the Illinois Nursing Home Administrators Association. Had a really nice visit with him. He absolutely told me that basically anytime you got this much public pay, you are going to have slow pay. He was amazed that we are either close to breaking even all the time or breaking even with only a third of the beds filled and paying a management company. He says we are doing everything right at this point and it only can go up. And so that's kind of where I'm at. I don't know. I wouldn't just want to keep going the direction we're going. Thank you.
All right. Moving on to 11, executive session, 5 ILCS 120-2, employment matters, the appointment, compensation, discipline, performance, and or discipline or dismissal of specific employee. Executive session 5 ILCS 122. 11, litigation when an action against affecting or on behalf of the particular public body has been filed to be pending before the court or administrative tribunal, or when the public body finds an action is probable or imminent. Do I have a motion to go into executive session?
So moved.
By Mr. Whalen. Do I have a second? By Mr. Meester. Any discussion? Okay, we'll take a roll call. Mr. Whalen?
Yes.
Mr. Bush?
Yes.
Ms. Jackie? Yes. Mr. Hadley?
Yes.
Baker, aye. All right, so we will go into executive session.